Professor Guo Tao speeches HIFU in the treatment of endometriosis and adenomyosis. So I would like to share with you my views on application of HIFU in the treatment of endometriosis and adenomyosis. So we have met a lot of challenges and difficulties in metriosis and adenomyosis, and it accounts for a large proportion of the benign tumors of women uterine fibroids. So we have spent a lot of time in talking about how to treat the disease. So for the women with reproductive age, it has a large impact on them. The largest impact or challenge is that the fertility. So what we can do now is to control, but we cannot cure or completely remove it. So the HIFU's application actually is based on these scenarios. And so today we have different experts from different countries today to offer us their solutions to these cases. So in the process of these treatments, I would say HIFU solution absolutely has brought many benefits to the doctors and patients. On the one hand, we get rid of the harm caused by surgeries and the diseases, and that leads to a good pregnant outcome. And so in 2022, the treatment of HIFU was inscribed into the consensus of China's adenomyosis treatment portfolio or consensus, and its impact on pregnancy now lacks some evidence or clinical evidence. So in the future, we need to do more to collect more follow-up visits and data collection. Based on the previous study on adenomyosis, in terms of pain or bleeding and quality of life improvement, we can see that in this meta-analysis, so the impact on the shrinkage of the uterine volume is significant, and the pains also has been reduced remarkably and improved the patient's quality of life. So HIFU benefits these patients in reducing these symptoms. So we still lack the random comparison with the other treatment solution. So the current data or information are gained from the HIFU treatment. So we lack some more better randomized comparison test. Another one is that the impact of the HIFU decision. So what might be the factors to impact on the patient's decision? So age and fertility requirement, anemia, a headache, and dysmenorrhea, and all these are the factors that influence the patient's selection. Because we know that traditional surgery may have some major impact on pregnancy. And the completeness of the uterine also will be impacted or influenced by these traditional surgeries. So when deciding whether to choose HIFU treatment or traditional surgery, these factors will certainly influence the patient's choice. And another one is the UAE and HIFU comparison. We have over 5,000 cases with some evaluation factors like recurrence rate and intervention and the other factors. So UAE's recurrence rate and repeated intervention surgery account for the largest part and enjoys more advantages. But for these part of these patients, so they may have larger uterine volume and adenomyosis, so they choose HIFU treatment. So in this selection, there are some factors that may cause the influence on the decision of these patients. In terms of pregnancy, another area that the young women will be very interested in because it is very important for the young women. Fertility is very important for them. So in different literature, we can see the different pregnancy rates. Some are higher, some are lower. So the impact on pregnancy and fertility, we still lack some data and statistics to support our conclusion. So this is the areas that we should focus in a future study, and also the impact on the fertility outcome. It has something to do with the size, the type, and the location of the adenomyosis. So the posterior wall location after the HIFU treatment will have a better outcome, and it is better than the diffuse ones. So postal wall location will also cause the impact on the fertility. So apart from HIFU treatment, long-term management is equally important. See, the single therapy cannot replace this comprehensive treatment. So some meta-analysis, we know that HIFU plus GnRHA is better than the single choice of HIFU treatment. And the evaluation of the menstruation flow, we can see the HIFU and GnRHA is better. So no matter it's in the size of the uterine or the recurrence rate, this combination will achieve better outcome. So we need long-term management. And HIFU itself has many advantages that we need no more words repeated on this. And in fact, it also has some side effects, including the lower part of the abdominal pains or adhesion. So adhesion actually influences the outcome of HIFU treatment, and it has some correlation, needs to be further explored. And after the HIFU treatment, there is also a case of the uterine rupture. So there is a some risk for the uterus rupture. And that poses some more challenges for us when we choose HIFU treatment, whether we should consider how to avoid the risk of uterine rupture. So from the present status and literature, we can see that there is still something to be desired for the present HIFU treatment. The lesion needs to be long-term managed, and also the dosage and the intensity needs to be further gained from a doctor's experience. And what kind of solutions can the doctors how can the doctors to manipulate these equipment in a better way and its influence on the fertility and so on. So in endometriosis cases, probably you have already done the similar case studies. So type 3, the most severe one, and very challenging, most challenging for the treatment. So according to the comparison study, HIFU treatment is safer, shorter in time, and no asthenia and low scores in pains. So it has more advantages to treat DIE. And this case has already been include 20 patients, and we can prove that HIFU treatment actually is safer and more feasible.